Hi, I am Dr. Reynaldo O. Joson, Director of the ROJoson PEP TALK. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP TALK. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I'll be tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in the Development of Cancer, which is part of the cancer course. Definition of terms in the title. Fundamentals mean the basic principles, the foundation, the basis. Generalities means majority, not all, not detailed, not specific. Development of cancer, meaning appearance and growth of cancer. This will be the contents of my talk. What is cancer? What are the different types of cancer? What are the possible and theorized causes of cancer? What are the behaviors of cancers? How does cancer kill a patient? Can cancer be prevented? Is cancer curable? So let's start with what is a cancer. Cancer is a medical disorder. It is a medical disease. The question is, what is the difference between disorder and disease? Are they the same or different? Loosely speaking, they are the same, but strictly speaking, there is a difference. A disease is a more specific term compared to disorder. Disease is characterized by specific symptoms and signs that identify it as an abnormal entity in the body. Whereas disorder is any abnormality or disruption in the normal structure and or function of the body, but not pinpointing to a specific entity yet. Thus, cancer as a disorder is an abnormality in the cell growth, development, degeneration, and death. Cancer as a disease is one that is identified as an entity with uncontrollable growth of cells with potential for invasion and spread. See specific definition below. So, definition of cancer. Cancer is a medical disease when some of the body's cells grow uncontrollably with a potential to invade the adjacent body tissues and organs and to spread to distant tissues and organs. So look here, the cancer cells are invading the adjacent tissues and organs and then spread to the distant tissues or organs. Example here, original tumor on the colon spreading to the lungs. So, is this a good definition of cancer that I have given? Does it apply to all kinds of cancer? Does it hold true for blood cancers which do not form solid tumors? The answer is yes, because leukemias, the most common blood cancers, have the potential to invade the bone marrow and then spread to distant tissues and organs like the lymph nodes, spleen, and brain. Before going further, let's clarify one associated term of cancer, malignant tumor, and differentiate it from benign tumor. Malignant tumor is the same as cancer. Benign tumor is not cancer. Malignant tumors invade and spread. Benign tumors do not invade or spread. So what are different types of cancers? There are more than 200 types of cancers. And the types of cancers can be categorized into whether solid or liquid, based on organ or tissue of origin, and based on the specific cell of origin. Whether solid or liquid cancer can be described as solid tumors or organ tumors, or liquid tumors or blood cancers. Both types are similar in that they are made up of abnormal cells that grow uncontrollably. Solid tumors form a mass or multiple masses, and the liquid tumors circulate around the body through the bloodstream. Based on the organ or tissue of origin, examples are cancers arising from the breast, brain, bone, stomach, esophagus, lymph nodes, epithelial tissues, connective tissues, muscular tissues, and nervous tissues. Note here that no organ in the body is spared of cancer. Rare, though, are cancers of the heart, spleen, and appendix. Based on the specific cell of origin, examples are carcinomas arising from the epithelial cells like adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, transitional cell carcinoma, sarcoma from muscle cells, fat cells, leukemias from the bone marrow and white blood cells, lymphoma from the lymphocytes, multiple myeloma from the plasma cells, melanoma from melanocytes, germ cell tumor, neuroendocrine tumor, and carcinoid tumor. All diseases have underlying and antecedent and immediate causes. All diseases have predisposing and precipitating and perpetuating factors. However, it is difficult to pinpoint the exact cause, a single cause of that, as oftentimes the cause is multifactorial. At best, we can only theorize the possible causes and factors. An example in analyzing for the causes of death secondary to a heart disease, coronary arterial atherosclerosis could be an underlying cause, myocardial ischemia an antecedent cause, heart failure is the immediate cause of death. For a patient not yet dying of a heart disease, an example in the analysis of the causation of the myocardial ischemia could be as follows. Genetic predisposition could be the underlying cause. Long-term unhealthy lifestyle could be the antecedent cause or precipitating or perpetuating factor. And coronary atherosclerosis could be the immediate cause of myocardial ischemia. For a patient with a cancer, an example in the analysis of theorized causation of the development of cancer could be as follows. Genetic predisposition could be the underlying cause. Long-term unhealthy lifestyle could be the antecedent cause or precipitating and perpetuating factor. And genetic mutation is the immediate cause. Another example for a cancer patient, genetic predisposition could be an underlying cause. Excessive exposure to radiation could be an antecedent cause or precipitating or perpetuating cause factor. And gene mutation is the immediate cause. Still another example for a cancer patient, no genetic predisposition, but the underlying cause is chronic irritation from chemicals, which now also becomes the antecedent cause or precipitating and perpetuating factor, and gene mutation is the immediate cause. So the last ultimate or proximate cause of cancer is changes or mutations to the DNA within the cells. The DNA inside the cell is packaged into a large number of individual genes, each of which contains a set of instructions telling the cell what functions to perform, as well as to how to grow and to divide. Errors in the instructions can cause the cell to stop its normal function and may allow a cell to become cancerous. The three most common theorized ways by which a gene mutation can instruct a healthy cell to form a cancer are the following. Allowing rapid growth. A gene mutation, usually from the so-called oncogene, can tell a cell to grow and divide more rapidly. This creates many new cells that all have that same mutation. Failure to stop uncontrolled cell growth. Normal cells know when to stop growing so that they have just the right number of each type of cell. Cancer cells lose the control through the tumor suppressor gene that tells them when to stop growing. So a mutation in the tumor suppressor gene allows the cancer cells to continue growing and accumulating. The third way, makes mistake when repairing DNA errors. So DNA repair genes look for errors in the cell's DNA and makes correction. That's a normal way of doing things. A mutation in the DNA repair gene may mean that other errors aren't corrected, leading cells to become cancerous. So that's one can say that cancer is a genetic disease that is caused by changes to the gene that control the way our cells function, especially how they grow and divide. What causes gene mutations? What are the underlying and antecedent and immediate causes? What are the predisposing, precipitating, and perpetuating factors? Gene mutations can occur for several reasons. For instance, gene mutations you're born with. You may be born with gene mutation that you inherited from your parents, but this type of mutation accounts for only a small percentage of cancers. So a gene mutation you're born with could be an underlying and predisposing factor or cause. Gene mutations that occur after birth. Most gene mutations occur after you are born and are not inherited. A number of forces can cause gene mutations such as smoking, radiation, viruses, cancer-causing chemicals, or the so-called carcinogens, obesity, hormones, chronic inflammation, and the lack of exercise. So these are the antecedent, precipitating, and perpetuating factors or cause. The gene mutations you're born with and those that you acquire throughout your life work together to cause cancer. So here again is a summary, it's an infographic of the causes of genetic mutation causing cancer, heredity, ultraviolet radiation, chemicals, viruses, smoking, and then uncontrollable cell divisions. What are the behaviors of cancer? When cancer develops, it has the potential to grow and invade or infiltrate adjacent organs or tissues, and also the potential to spread to distant sites in the body. The rate of growth and spread of cancer is dependent primarily on the behavior of the mutated gene and secondarily on the presence of promoting factors in the person's body, like medications and hormonal levels, and in the environment, like cancer-causing chemicals. A cancer that has spread from the place where it first formed to another place in the body is called metastatic cancer. The process by which cancer spreads to other parts of the body is called metastasis. Metastatic cancer has the same name and the same type of cancer cells as the original or primary cancer. For example, breast cancer that forms a metastatic tumor in the lung is metastatic breast cancer and not lung cancer. How does cancer kill a patient? So these are the direct causes. It can kill a patient when it invades or spread to essential organs like your liver, lungs, and brain and stop them from functioning properly. It can erode into major big vessels, blood vessels, and causes massive bleeding. It can cause a fatal pressure effect, such as brain herniation, and it can cause obstruction to hollow organs, such as intestine. The secondary or indirect causes are the following. Secondarily, it can cause malnutrition because of inadequate nutritional intake as a result of intestinal involvement or extreme anxiety, infection, and bleeding due to defective clotting mechanism caused by the original cancer. Can cancer be prevented? Yes, but not all. Not 100% preventable. Cancer develops through multiple factors such as genetic predisposition, environmental factors including lifestyle and viral infections, and aging, that it is difficult to identify a specific strategy of prevention. There are some things that can increase the risk of cancer that we cannot change. These include things like getting older and damaged DNA inherited from a parent. So this shows an age as a risk factor in the DNA change, gene mutation, and cancer development. In the older people, there are usually more new mutations, which can easily lead to cancer. Though managing certain controllable risk factors such as your diet, physical activity, and other lifestyle choices as being recommended can lower your chances of developing cancer, but remember, no guarantee, best effort, and best of luck. So here are some cancer prevention mitigation tips. Don't use tobacco. Eat a healthy diet. Maintain a healthy weight and be physically active. Protect yourself from the sun. Get vaccinated. Avoid risky behaviors. Be in touch with reliable medical information on cancer risk and prevention. Don't use tobacco. Smoking has been linked to various types of cancer, including cancer of the lung, mouth, throat, larynx, pancreas, bladder, cervix, and kidney. Chewing tobacco has been linked to cancer of the oral cavity and pancreas. Even if you don't use tobacco, exposure to secondhand smoke might also increase your risk for lung cancer. Eat a healthy diet. Eat plenty of fruits and vegetables. Maintain a healthy weight. If you choose to drink alcohol, do so only in moderation, because the risk of various types of cancer, including cancer of the breast, colon, lung, kidney, and liver, increases with the amount of alcohol you drink and the length of time you have been drinking regularly. Note that in women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts might have a reduced risk of breast cancer. Maintain a healthy weight and be physically active. Maintaining a healthy weight might lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon, and kidney. Physical activity on its own might lower the risk of breast cancer and colon cancer. Protect yourself from the sun to prevent skin cancer primarily. So avoid midday sun. Stay out of the sun between 10 a.m. and 4 p.m. when the sun's rays are the strongest. Stay in the shade. Cover the exposed areas. Don't skimp on sunscreen. Use broad spectrum sunscreen with SPF of at least 30. Avoid tanning beds and sun lamps. Get vaccinated if you are at high risk. Cancer prevention also includes protection from certain viral infections which might cause cancer. If you are at high risk of hepatitis B, go for vaccination because hepatitis B can increase the risk of developing liver cancer. Human papillovirus, HPV, is a sexually transmitted virus that can lead to cervical and other genital cancers as well as squamous cell cancers of the head and neck. If you are at risk of HPV because of your lifestyle, go for the vaccination. Avoid risky behaviors, practice safe sex, avoid HIV and HPV because these have higher risk for cancers of the cervix, anus, penis, throat, vulva, and vagina, liver, and lungs. Don't share needles. Again, to avoid HIV and hepatitis B and C, as these have higher risk for liver cancer. Be in touch with reliable medical information on cancer risk and prevention. Knowledge is power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to prevent the controllable risk of cancers. Before I answer this question, let's have some definition of terms. Okay. The question is cancer curable? The conventional definition of medical cure is that it's a condition that's completely gone and will never come back. For example, if you have appendicitis and doctors remove your appendix, you have been cured. If you have gallbladder stones and doctors remove your gallbladder with the stones, you have been cured of the problem. For cancers, no doctors can guarantee your cancer will not come back. In other words, no doctors can guarantee you will be cured of cancer after treatment, after any type of treatment. Why? Number one, doctors don't know everything about the disease yet. The best knowledge so far is that the ultimate or proximate cause of cancer is changes or mutations to the DNA or the genes within the cells. There are several theories on how gene mutations can lead to cancer development, allowing rapid growth, failure to stop uncontrolled growth, makes mistakes when repairing DNA errors, but unfortunately, the exact mechanism are not yet definitely known. That's the reason why targeted cancer therapies on the molecular or gene level up to the present are not yet 100% successful. Second reason, the usual cancer treatment modalities, surgery, chemotherapy, and radiotherapy, are strictly speaking treating the primary cause of the cancer, or are not strictly treating the primary cause of the cancer. They just extirpate with surgery, kill with drugs, chemotherapy, and burn the cancer with radiotherapy. If the primary cause is still around, there is always the possibility of recurrence after treatment. 3. No two cancers are the same. Each individual cancer possesses different biologic characteristics, even cancers of the same type. Some are slow growing and some are fast growing. Usually, the biologic behavior of the cancer is not known at the time of treatment. Thus, only time will tell the outcome of the treatment. Number 4, after treatment, some cancer cells may remain somewhere in the body unnoticed, and patients are asymptomatic for a long time, even as long as 10 years, but can eventually grow, divide, invade, and spread to distant areas and become a nuisance, or what is called a recurrence. So this is a reason why doctors do not guarantee no recurrence. At a time there are no symptoms, doctors use the word remission. Complete remission means that tests, physical exams, scans show that all signs of your cancer are gone. Some doctors also refer to this as complete remission, as no evidence of disease or no evidence of recurrence, and ED and ER. But mind you, complete remission does not mean cure. Some cancer cells can remain unnoticed in the body for years after treatment. If a cancer returns after it has been in remission, it's called a recurrence. A cancer can recur in the same place as it was originally diagnosed, or it can recur in a different part of the body. So up to now, there is no true cure for cancer. No guarantee it will not recur. Physicians do not talk of cure. They use the word remission if there are no signs of recurrence, but they, together with the patients, always hope for a cure, especially for those cancers which are recognized, diagnosed, and treated early, and with known track record of slow growth in behavior. So, summary, conclusion, takeaway. I have expounded on these various questions. What is cancer? What are the different types of cancer? What are the possible and theorized causes of cancer? What are the behaviors of cancer? How does the cancer kill the patients? Can a cancer be prevented? Is cancer curable? To repeat, definition of cancer. What is a cancer? It's a medical disease when some of the body's cells grow uncontrollably with the potential to invade the adjacent body tissues or organs and to spread to distant tissues and organs. Showing invasion of the cancer cells, showing spread to the distant organs, lungs, from the colon to the lungs. So what are the different types of cancer? It is said that there are more than 200 types. Okay? The cancers can be categorized into whether solid or liquid, based on organ or tissue of origin, and based on specific cell of origin. What are the possible theorized causes of cancer? We still don't know everything about the disease. The best knowledge so far is that the ultimate or the proximate cause of cancer is changes or mutations to the gene or the DNA within the cells. Okay. So the theories are these three: allowing rapid growth, failure to stop the uncontrolled growth, and makes mistakes when repairing the DNA errors. Gene mutations you're born with and those that you acquired throughout your life work together to cause cancer. And cancer develops through multiple factors such as genetic predisposition, environmental factors, including lifestyle and viral infections, and aging, that it is difficult to identify the specific cause. And when cancer develops, in terms of behavior, it has the potential to grow and invade and infiltrate the adjacent organs or tissues, and also the potential to spread to distant sites in the body. The rate of growth or spread of cancer is dependent primarily on the behavior of the mutated gene and secondarily on the presence of promoting factors like medications, hormonal levels, and the environment like cancer-causing chemicals. How does a cancer kill? Direct cause, it invades the essential organs like liver, lungs, brains, and then stop them from functioning properly, eroding into major blood vessels and causing massive bleeding, causing brain herniation, causes obstruction to hollow organs or such as the intestine. And secondary causes, okay, malnutrition, infection, and bleeding. Can cancer be prevented? Not all, because cancer develops through multiple factors such as genetic predisposition, environmental factors, aging, that it is difficult to identify a specific strategy of prevention. The other reasons for this is that there's something that can increase the risk of cancers, but we cannot change. This includes getting old and also the damaged DNA inherited from a parent. Although we can try to control the risk factors for some cancers like diet, physical activity, and other lifestyle choices. Okay, but there is no guarantee. Okay? Best effort, best of luck. Is it curable? Up to now, there is no true cure for cancer, no guarantee it will not recur. Physicians do not talk of cure. They use the word remission if there are no signs of recurrence, but together with the patient, they always hope for a cure, especially for those cancers which are recognized, diagnosed, and treated early and with known track record of slow growth in behavior. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on fundamentals and generalities in cancer development, because knowledge is power. It gives power. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, kapangyarihan, to prevent cancer, and in case it is not prevented, to gain greater control over decisions in the management. With that, I end my PEP talk, Fundamentals and Generalities in Development of Cancer. I hope I have empowered you to have a better understanding of the fundamentals and generalities in the development of cancer as a health disorder or disease. Thank you and good day. Mabuhay kayong lahat.